Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What is HPV?
HPV is human papillomavirus. It's the most common virus to be transmitted sexually. It causes millions of infections every year. Most people get better from it, but we worry about the people who don't get better from it because it can cause cancer later on. It can cause cancer of the uterus, cancer of the cervix, cancer of the genital organs, anal cancer, and even head and neck cancers too.
What is the HPV vaccine?
The vaccine is made up of pieces of the dead virus that stimulate an immune response, so when you come in contact with the virus, you won't get infected with it.
So who should get the HPV vaccine?
The vaccine is recommended by the Centers for Disease Control and the American Academy of Pediatrics and the American Academy of Family Practice for all boys and girls between 11 and 12 years old. The idea of giving it at that age is to get them immune before they become sexually active. And what we have found is that the response to the vaccine is better at that age than it is in older teenagers.
Should older children still get the vaccine?
It's not too late to get the vaccine when you get older. But the idea is do it early when the immune response is the best, and do it before you become sexually active. And adolescents don't do a good job of coming into the doctor and saying, I'm going to be sexually active in 6 months, so immunize me now.
Why is it important for both boys and girls to get vaccinated?
It was first tested in girls because the major forms of cancer that it caused were cervical cancer that women would get. But as it has been studied now in boys, they find that it produces a very good immune response, and in most situations, girls get infected from boys who transmit the virus. So we want to have both boys and girls immunized so it won't be passed around.
What forms of cancer does the vaccine prevent in boys?
Penile cancer is not very common, but it can happen and it can be devastating. Anal cancer can happen. And again, one of the things that people are seeing is a rise in the incidence of head and neck cancers, in part related to oral sex practices.
How costly is the vaccine for patients?
The good news is for those who live in Massachusetts, the vaccine is covered by the state. So insurance plans all cover the vaccine. If you don't have insurance, there's a program called Vaccine for Children, which will cover the cost of the vaccine. And in Massachusetts right now, all vaccines are paid for out of a state and insurance provided fund for vaccines. So you have to be 18 up through 18 to get your vaccines. If you start the series before 18 and then don't finish it until you're after 18, as long as you've started before, it'll be covered by the state.
HPV can be a touchy subject. How do you recommend parents discuss it with their children?
When my daughter was 10 years old, I sort of jokingly went through the phone book looking for convents. Where could I send her for until she was 42? But the reality is children do start having sex sooner than we know. Probably 25% of high school students by the time they're seniors have had sex with 4 or more partners. Sexual activity can start very young. A recent study said that about 10 to 15% of girls before they graduated from high school were actually forced to have sex. So these are things that we have to know about and have to prepare for. Very similar to bike helmets. You want your kids to put on a bike helmet before they ride their bike, not when the car is coming at them or after they've been hit. And it's the same with this vaccine. We want them prepared for when they make the decision to be sexually active. Because, again, the younger they are, the better they respond to the vaccine.
Are there any specific populations that should be targeted for the vaccine?
There are recommendations for children who are at risk for sexual abuse, that the vaccine can be started as young as 9 years old. There are recommendations for men who have sex with men that they should get the vaccine very important for that group also. When we talk about sexual activity, people tend to think only about penile vaginal sex. But sexual activity can be oral sex, it can be anal sex, it can even be hand to genital, and the virus can be transmitted those ways too. So there have been studies that have said virgins, people who have not had vaginal intercourse, have been infected with HPV by some of these other contact methods.